So hello students, very good morning to everyone. In the last lecture we have started with unit 2 and this is the topic that we had covered in the last lecture that we had learned in the last lecture, that is synthesis of tramadol. And this synthesis of tramadol, this tramadol is antipyretic drug, and its synthesis starts with salicylic acid. When this salicylic acid undergoes catalytic hydrogenation, reduction of this double bond into single bond in presence of nickel and H2, you will get this reduced product, that is 2 hydroxy 2 hydroxy cyclohexane 1 carboxylic acid. Then this 2 hydroxy 1 cyclohexane carboxylic acid undergoes oxidation in presence of oxidizing agent, and the oxidizing agent is chromic acid. So the role of this chromic acid is it oxidizes this alcohol. It's a secondary alcohol into ketone. So it oxidizes this your alcohol, this hydroxy group into ketone. You will get this 2-oxycyclohexane 1 carboxylic acid. Then the step 2. So the synthesis of tramadol takes place in 2 steps. The first step is preparation of this uh, 2-oxycyclohexane 1 carboxylic acid. Then the second step, your 3-bromoanisole. So this is the structure of that 3-bromoanisole. So this 3-bromoanisole react with your magnesium in presence of tetrahydrofuran, THF, and ether. Here, this method is the preparation of Grignard reagent, and this reaction is called as metal insertion reaction because your metal is inserted in this CBr bond, and you will get this Grignard reagent. Then this Grignard reagent react with your 2-oxycyclohexane 1 carboxylic acid that you have synthesized in step 1. So the reaction between these two molecules takes place. So this your Grignard reagent are nucleophilic, they are act as a nucleophile. So the nucleophile will attack on this carbonyl carbon, and then the what you are using, you're doing this reaction in aqueous HCl, so you'll get this alcohol. Then the condensation of this product with dimethylamine, you will get this product. Then this product undergoes reduction. This will undergo reduction in presence of lithium aluminum hydride. So this carbonyl group convert to CH2, and you will get this tramadol. This tramadol is a antipyretic drug, and uh, so it is used in the severe physical pain. So sorry, it's a analgesic drug. It's a potent analgesic drug and used in the severe physical pain. So this tramadol produce analgesic action similar to opiates. It produce analgesic action similar to opiates, and the opiates are nothing but your morphine, codeine, thebaine, then your heroin. So these are the opiates. Then papaverine, nascopine. So these are the opiates. So it produces analgesic action similar to opiates, and it is formed as a mixture of cis and trans. But it is observed that the trans isomer actually has an analgesic action. So the trans isomer actually has a your analgesic action. So students, today we are going to learn very important chapter, that is 2.1, anti-inflammatory drugs. Anti-inflammatory drugs. So before that, we'll see what is inflammation. So inflammation can be defined as the series of changes that occur in the living tissue. The series of changes that occur in the living tissue following an injury, that is called as inflammation. So inflammation, it is defined as series of changes that occur in a living tissue following an injury, that is called as inflammation, and it is recognized by the following symptoms. So these are the symptoms These are the symptoms of inflammation. So by observing, by using these symptoms, you can identify whether you are having inflammation or not. So first one is collar. Collar means heat. Then rubor. Rubor means redness. Tumor. Tumor means swelling. Dollar, pain. So the inflammation can be recognized. Collar heat. Then rubor, redness. So you see the redness of this wedge has been legs due to inflammation. Then tumor, swelling. In this image you can see that the swelling of this your leg. And the fourth symptom is dollar. Dollar means pain. So these are the symptoms of inflammation. You can easily recognize the inflammation, and the symptoms are collar heat. Collar means heat. Rubor means redness. Then your tumor. Tumor means swelling. Then your dollar. Dollar means pain. Now, now you can easily define what are anti-inflammatory drugs. So you can write, you can simply say that the drug which is used for the treatment of inflammation, that is collar, that is heat, redness, swelling, or a pain. So the drug which is used for the treatment of inflammation, that drug is called as anti-inflammatory drug. So the drug which is used for the treatment of inflammation, that drug is called as anti-inflammatory drug. So this is all about anti-inflammatory drugs and its symptoms. It is recognized by the following symptoms: that heat, redness, swelling, and pain. Then in the next slide, we'll see the causes of this inflammation. So what are the factors that is responsible for inflammation, the causes of inflammation? So the first one is physical agent. Physical agent like mechanical trauma, ultraviolet, and ionizing radiation. The physical agent like mechanical trauma, ultraviolet, and ionizing radiation. So this is the first factor which responsible for inflammation. So this ultraviolet and ionizing radiation is also responsible for inflammation. It may causes redness and heat. Then the second one is chemical agent like organic compound. So some organic compounds such as phenols, toxic amines, and caustic organic compounds like nitric acid, sulfuric acid, perchloric, hydrofluoric acid, caustic soda, and caustic potash. So these are the some organic compounds which are responsible for inflammation. It may cause itching, then heat, redness, the burning of the skin. So the chemical agents like organic compounds such as phenol, toxic amines, caustic soda, caustic potash, some caustic organic compounds like nitric acid, sulfuric acid, hydrochloric acid, caustic soda, and caustic potash. These are the some organic compound which causes the inflammation. Then the third point is biological agent. The biological agent such as toxins of bacteria, hypersensitivity caused by sensitized bacteria, and intracellular replication of virus. So this is the third factor that causes the inflammation, that is toxins of bacteria, hypersensitivity caused by sensitized bacteria, and intracellular replication of virus. So this is the biological agent which cause the inflammation. So due to the action of this bacteria and viruses, it causes the inflammation. Then the fourth one is pathological condition like rheumatoid arthritis, which is autoimmune disease. So this is one of the autoimmune disease, that is rheumatoid arthritis. Rheumatoid arthritis also responsible for inflammation. So these are the four factors which causes the inflammation. The inflammation may be caused by injury, or brought about by a variety of conditions such as physical agent like mechanical trauma, ultraviolet and ionizing radiation, chemical agent like organic compound such as phenol, then toxic amine and caustic soda, caustic organic compound like nitric acid, sulfuric acid, perchloric acid, caustic soda and caustic potash. And the third one is biological agent like toxins of bacteria, hypersensitivity caused by sensitized bacteria, intracellular replication of virus. Then the fourth one is pathological condition like rheumatoid arthritis, which is a autoimmune disease. So these are the factors. So, however, this inflammation is a normal and essential and protective response to any noxious stimulant or a foreign microorganism or a foreign organism that may threaten the host and may vary from localized it may vary from that threaten may be vary from localized reaction to complex response involving the whole organism. So, however, this inflammation is a normal, essential protective response to any noxious stimulant that may threaten the host and may vary from localized reaction to a complex response involving whole whole organism. So any inflammation may be either primary or a secondary response. So the any inflammation may be either primary or secondary response to it that to the tissue damage. So it is the primary or secondary response to the tissue damage. Primary inflammation consists of direct defense reaction. So the primary inflammation consists of direct defense reaction of your body to the external agent. The primary inflammation consists of direct defense reaction of your body to that external agent, but secondary inflammation is the indirect defense. Secondary inflammation is the indirect defense response due to physiological condition of the cell due to autoimmune disease like rheumatoid arthritis, ankylosing spondylitis. So secondary inflammation is the indirect defense response due to physiological condition of the cell due to autoimmune disease like rheumatoid arthritis and ankylosing spondylitis. This rheumatoid disease is the most important cause of inflammation. This rheumatoid disease is the most important cause of inflammation condition which result in crippling effect on the people. It which result into crippling effect on the people. So due to this rheumatoid arthritis, काही crippling effect on people means लोक अपंग वगैरे होतात. Then the next point is, we'll see the next point. What are the drugs that use as a anti-inflammatory drugs? So there are two types of drugs which have been used for the treatment of inflammation. So the first class is steroidal anti-inflammatory drugs. Steroidal anti-inflammatory drug means SAID. SAID drugs. So the glucocorticoids, it is a hormone. So the glucocorticoids are the adrenocortical hormones which are used as a anti-inflammatory drug. So this hormone is used as a anti-inflammatory drug. For example, cortisone, hydrocortisone, acetate are used in the formulation for oral and topical application. So this is the structure of one steroid, general structure. RnR1. So this RnR1, this R is equal to hydrogen, R is equal to hydrogen. Then the structure of then this structure will become prednisolone, and this R is equal to fluorine, and this R is equal to CH3. Then the structure will become betamethasone. So this betamethasone and prednisolone, you have seen this your medicine anti-inflammatory drug in your um, uh, in in your medical store. So this prednisolone and betamethasone are the modified steroid. These are the modified steroid and having additional double bond at C1 and C2. So it having additional double bond at C1 and C2, and due to the presence of this double bond, anti-inflammatory activity increased by 3 to 5%. The anti-inflammatory activity is increased by 3 to 5% due to the presence of this double bond at C1 and C2. Prednisolone acetate is used as an intermediate acting drug. So it is intermediate acting drug, intermediate anti-inflammatory drug, whereas this betamethasone is a long acting agent. Betamethasone is a long acting agent, and they are used to treat inflammatory condition caused by arthritic and rheumatoid disease. It is used to treat the inflammatory condition caused by arthritic and rheumatic disease, mainly for topical applications. However, this steroidal anti-inflammatory agent have some side effects. So there are some side effects of this steroidal anti-inflammatory drugs, that is anorexia. Anorexia means that patient don't want to eat. That is त्याला आपण मराठीमध्ये भूक मंदावणे म्हणतो. Then gastritis. Then gastritis means जठराची सूज. Then hypertension, that is high blood pressure. Then your glaucoma means काचबिंदू. Then it also causes psychotic disorder with high doses. When you are taking the high dose of this SAID drug, then it also causes psychotic disorder. It have the effect on your brain. Then the second class is the next slide. So second class is non-steroidal anti-inflammatory drugs, that is NSAID drug, non-steroidal anti-inflammatory drugs. So these drugs don't have the steroidal structure, that is the compound that having 4 to 5 rings that fuse together. That is the basic structure of steroid. So this is your steroid. It having 4 5 rings fused together, and so they are not in a steroidal form. So that's why that this drug is called as non-steroidal anti-inflammatory drug. So the steroidal anti-inflammatory drug agent have some several adverse side effects. So SAID drug have some several adverse side effects. Hence, they are more or less replaced by non-steroidal anti-inflammatory agent, that is NSAID. So these drugs are mainly used in the treatment of rheumatic fever, संधिवाताचा ताप, then rheumatoid arthritis, संधिवात, then ankylosing spondylitis, gout, and osteoarthritis. So it is used, this NSAID drug used in the treatment of rheumatic arthritis, then rheumatoid arthritis, ankylosing spondylitis, gout, osteoarthritis. So this anti-inflammatory drugs modified the inflammation. It modified the inflammation response to the disease, but they are not curative and do not remove the underlying cause of the disease. So these inflammatory drugs modify the inflammatory response to the disease, but are not curative and do not remove the underlying cause of disease. An ideal anti-inflammatory drug should affect the aberrant uncontrolled inflammation and not interfere with the normal inflammatory response, which is the vital part of body defense mechanism. So this NSAID drug, that is non-steroidal anti-inflammatory drugs, are classified on the basis of their chemical structure. So this NSAID drug have been classified on their chemical structure. The first class is your aryl acetic acid derivative, then N-aryl anthranilic acid derivative, salicylic acid derivative, aryl propionic acid derivative, naphthalene acetic acid derivative, organogold compound, and pyrazolone derivative. So this NSAID drug has been classified on the basis of its chemical structure, that is into these types, that is N-aryl acetic acid derivative, N-aryl anthranilic acid derivative, salicylic acid derivative, aryl propionic acid derivative, naphthalene acetic acid derivative, organo gold compounds, and pyrazolone and pyrazolidine derivative. So we'll see two, three of this class. The first one is some of the group have been discussed below. So the first one will start with aryl acetic acid derivative. So the example of this aryl acetic acid derivative are diclofenac and aceclofenac. This diclofenac and aceclofenac, we have seen this in a medical store. uh, Doctor is prescribing this when the person is suffer from inflammation, that is any inflammation like redness, heat, swelling or pain. Doctor is prescribing this drug. So these drugs are aryl acetic acid derivative, and these are the structure of diclofenac and aceclofenac. And this aceclofenac as well as diclofenac both are uh, an anthracic acid derivative, while this aceclofenac is a diclofenac derivative, because these are diclofenac, and in aceclofenac this CH2 COH group is joined to this oxygen, so it's a this is the derivative of this diclofenac. Aceclofenac is the derivative of diclofenac, and both are used to treat the inflammation caused by bo- both are used to treat the inflammation caused by, then the uses is both are used to treat the inflammation caused by osteoarthritis, rheumatoid arthritis, ankylosing ankylosing spondylosis, So these are the uses. It is used to treat the inflammation caused by osteoarthritis, rheumatoid arthritis, ankylosing spondylosis, and the side effect is it causes ulceration and hepatotoxicity. It causes ulceration and hep, hepatotoxicity. It's a hepatotoxicity. It causes hepatotoxicity. So this is about the first class aryl acetic acid derivative, and the example are diclofenac and aceclofenac. So these are the images of diclofenac and aceclofenac. This aceclofenac is a derivative of diclofenac, and both are anti-inflammatory drugs and used to treat the inflammation caused by osteoarthritis, rheumatoid arthritis, and ankylosing spondylosis. And the side effect, and they have some side effects such as ulceration and hepatotoxicity. So these are the side effect of this diclofenac and aceclofenac. This is all about the first class aryl acetic acid derivative. Then the second class is N-aryl anthranilic acid derivative. N-aryl anthranilic acid derivative. So this is the structure of mefenamic acid, and the uses of this mefenamic acid is it is used to treat the symptoms of pain of inflammation. It is used to treat the symptom of pain and inflammation, but don't so they do not or but they don't here the don't is that but they don't treat or do not treat the disease that cause those symptoms. It do not treat directly that disease, but it treat the symptoms. So they used to treat the symptoms of pain and inflammation, but they do not treat the disease that the cause that that the cause those symptoms. So they don't treat the disease that causes those symptoms. And the side effects are diarrhea and peptide ulcer. So this is the side effect of this mefenamic acid. So this is about second class N-aryl anthranilic acid derivative. So this N-aryl anthranilic acid derivative, under the class of this we are taking this example mefenamic acid, and it is used for the treatment of symptoms of pain and inflammation. They don't treat the disease that cause those symptoms, and the side effect are it causes diarrhea and peptide ulcer. So this is all about the second class. It is one of the anti-inflammatory drugs. Then thank you. So now I will show you two three videos that is related to anti-inflammatory drugs. and the inflammation. So you have to watch that video. You will get you can thoroughly understand what is inflammation and what are the anti-inflammatory drugs.
Inflammation is a local immune response to tissue injury or infection, experienced as heat, redness, edema, pain, and loss of function. Immediately after injury, inflammation begins with brief vasoconstriction of the local blood vessels to reduce blood loss and formation of a clot to stop the bleeding. Then, stimulated by cell injury and death, local cells release vasoactive chemicals, such as prostaglandins and histamine, to dilate local blood vessels, leading to increased blood flow to the area. These chemicals also cause endothelial cells in small blood vessels to contract, opening spaces between them. This increased capillary permeability allows fluids and proteins to pass from the blood into the tissue. Next, during a multi-stage process called chemotaxis, circulating immune cells, called neutrophils, move out of the blood vessels to the site of injury and destroy pathogens and damaged cells. Chemotaxis begins when cells at the injury site release messenger molecules called chemoattractants, which cause local endothelial cells and circulating neutrophils to stick together. Next, in a process called diapedesis, neutrophils squeeze through the endothelial gaps. The neutrophils migrate to the injury site by following a chemotactic gradient. Upon arrival, the neutrophils encounter bacteria, engulf them, and digest them in a process called phagocytosis. After destruction of the bacteria and removal of cellular waste, tissue repair begins when locally produced growth factors cause local fibroblasts to begin dividing rapidly and secreting large quantities of collagen to reinforce the wound. Anti-inflammatory drugs inhibit inflammation by blocking production of inflammatory chemicals. The most common drugs for inflammation are non-steroidal anti-inflammatory drugs, or NSAIDs, such as aspirin and ibuprofen. They contain an enzyme called cyclooxygenase, or COX, that inhibits the production of prostaglandins and several other inflammatory chemicals, thus reducing vasodilation, edema, and pain associated with inflammation.
Damage to the body's tissues through heat, chemicals, sunburn, cuts, or microbial infections triggers a general, nonspecific defensive response called inflammation. Signs and symptoms of inflammation include redness, pain, heat, swelling, and sometimes loss of function. Inflammation has three main functions: to destroy the agent causing injury, to limit the effects of the agent on the rest of the body, and to repair or replace damaged tissue. Damaged cells release several chemicals, such as histamines, prostaglandins, and leukotrienes, Certain components of the complement system can also stimulate the release of histamines. One function of these chemicals is to cause vasodilation, an increase in the diameter of blood vessels. Vasodilation results in more blood and therefore more phagocytes, oxygen, and nutrients being delivered to the site of injury. This increased blood flow results in redness, heat, swelling, and some of the pain associated with inflammation. The increased blood flow delivers phagocytes, such as monocytes and neutrophils, to the scene. The phagocytes stick to the walls of the blood vessels in a process called margination, then squeeze through the gaps between the cells in a process called emigration or diapedesis. Within about an hour of tissue damage, the phagocytes begin to destroy the invading microorganisms by phagocytosis. After engulfing large numbers of microorganisms and damaged tissue, the phagocytes die, forming pus. The final stage of inflammation is tissue repair. The increased delivery of nutrients and oxygen from vasodilation aids in this process. Other components of the blood lead to the formation of blood clots, which seal off the site of injury. The migration of phagocytes and other factors to the site of injury usually results in the destruction of microorganisms. Phagocytes directly attack the microorganisms, but other components of the body's defense systems, such as the complement system, are also involved. Even if destruction of the injury-causing agent is not possible, inflammation helps to limit the effects of the agent by confining the agent and its byproducts to the site of injury. This is accomplished through the clotting that occurs during tissue repair. Inflammation leads to repair and replacement of damaged tissue when possible. Different tissues have different capacities to regenerate themselves. While the outer layer of skin is able to completely repair a small cut, leaving no scar, cardiac muscle tissue does not regenerate at all. Certain immune system cells, such as macrophages and neutrophils, utilize phagocytosis to ingest and destroy invading microorganisms. These phagocytes attack and destroy invaders using chemotaxis, adherence, ingestion, digestion, and elimination. Chemotactic chemicals attract the phagocytes to the site of infection, and opsonins aid in adherence of the phagocytes to the surfaces of the microorganisms. The complement system is composed of several proteins that circulate in the blood serum. Activation of the complement system initiates a cascade of events that aids in the destruction of invading organisms. The complement system helps induce the inflammatory response and produces opsonins and chemotactic factors that aid in phagocytosis. Components of the complement system also directly attack the cell membranes of microorganisms, causing cytolysis.